Welcome to the Couplet Care podcast. I'm Kristin Tully, founder and chief scientist. In this podcast, we invite maternal, infant, and family health thought leaders to share their perspectives and work. Connecting around research and experiences is key for implementing more meaningful support for families and those who care for them. It's a joy to welcome Dr. Kanika Harris. Dr. Harris is a behavioral health scientist, filmmaker, and executive director of the National Association to Advance Black Birth, a national nonprofit committed to improving birth outcomes for Black and Indigenous families. She previously served as the Senior Director of Maternal and Child Health for the Black Women's Health Imperative. Her work focuses on promoting maternal health equity through research, workforce development, and storytelling. She received her master's degree in public health and international development from Morehouse School of Medicine and her PhD in health behavior and health education from the University of Michigan. She is also a mother. I'm so grateful for you, Kanika, to connect and to just talk about, supporting people together. Welcome.
Absolutely. Welcome. It's great to be here, to be in partnership with you.
Yeah.
Yes.
So just share a little bit. What are you up to now?
What am I up to? So this is my second year as the executive director of the National Association to Advance Black Birth. We have a long legacy and history, really over 30 years of being one of the first birth training resources for communities of color. So the organization used to be called International Center for Traditional Childbearing, run by Mama Shafia Monroe. And then she branched off to do more work, and the name was changed to NAABB. But with that legacy, she was the first to hold birth worker trainings for birth workers of color. When DONA was out and there wasn't really a space for birth workers of color, she held some of the first trainings for birth workers of color to support birth workers. So we have a long legacy there. We're most known for our Black Birthing Bill of Rights, which is a resource for clinicians, birth workers, patients, families to use. That is a beautiful piece of art and activism, really, to advance the rights of birthing people, and just a reminder of the rights that you have as a birthing person, and a reminder for clinicians and birth workers as well of how we navigate this terrain together. So we are proud that now we have it in print, and we have a deck of cards that's very beautiful that you can use. We're doing trainings, our first ever trainings of the Black Birthing Bill of Rights in California with nurses in conjunction with A1, Association of Women's Obstetrics and Neonatal Nurses, Women's Health Obstetrics and Neonatal Nurses. That's always a tongue twister for me. So we're doing a lot. We're also working in the policy space. We have a collective called the Midwifery Policy Collective, where we're working with other organizations like Elephant Circle, Birth Center Equity, National Association of Certified Professional Midwives, Innovation for Medicaid, Institute for Medicaid Innovation. I think I'm missing one other group, excuse me, but we're working as a collective to advance midwifery policy across the nation, state by state. So a lot happening.
Thank you so much for sharing that history. What a legacy, and to honor and to live. And I love how positive and affirming and so sort of like calling people forward the Black Birthing Bill of Rights is. I think such a wonderful tool.
Yes, thank you.
And you made a film.
Oh my God. How did I do that? Well, that was a long time in the making. Another long legacy. Yes, I made a film with my co-director, who's also a midwife, Stephanie Etienne. We started this journey back in 2017 to create a film that really hones in on, I guess, the full spectrum of what we experience in this country birthing, especially as Black birth workers. What makes the film unique is that all the subjects or protagonists in the film actually work in maternal health. So you have Shalon Irving, who unfortunately passed away, and her story is well known in through ProPublica because she was an EIS officer, an epidemiologic intelligence officer, and she served for the CDC. And she passed away, unfortunately, 3 weeks postpartum. And then we have myself, who's also featured in the film as someone who had a near miss, which means I almost did not make it in childbirth, and also experienced stillbirth. And then we have Ebony Marcel, who is the director of Community of Hope, which is the only freestanding birth center in Washington, D.C., and her journey through infertility and becoming a mom. So it's 3 journeys of motherhood, but they are also intergenerational. And what I like about the film over the last 8 years is you just see the transformation of healing that takes place in those 8 years. Through the stories, you see some reconciliation, you see the joys, you see the miracles. So it doesn't start and end at, the hard moments or the heartache, but you see the full grasp of what's happening. And, we've been really overwhelmed with the interest in the film. So over Black Maternal Health Week, it will be shown around the country, I think over 15 times. We obviously cannot make all those screenings. We will make some, but we've been able to have different organizations, universities host the screening over Black Maternal Health Week. So we're really excited about that.
It's amazing.
Yeah.
And thank you for sharing, including, that this is personal for you and for so many of us in this space striving to better support folks. And another way that we're connected is you're an advisor for Couplet Care with the Bassinet.
Yes, absolutely. Yes, I had the wonderful experience at the A1 conference in California to sit with the bassinet, work with the bassinet, work with the little baby who I wanted to take home. Not a real baby, the baby doll. I think her name was Florence. She was wonderful. And just really get to experience how innovative, but just as well. I don't like to always use the word innovative because it's just like, this is just what we should have. And to say that we have to be quote unquote innovative for something that should just be simple and designed for women with women in mind in the first place, or birthing people in mind in the first place, that it's just an amazing tool that really meets the needs of the mom. With my own experience, I was explaining to your research assistant who doesn't have children yet, and she was just curious as to and I was like, let me tell you why this is so amazing. And I was like, because I had twins, and when you have your baby and you're sore and you've just had a C-section, you may not be eating well yet, you can't exactly get out the bed yet, but but you want to nurse your baby, right? You want to have the experience of making sure your baby latches. So you have that extra stress, but you can't always get your baby when you needed the baby. And then you have to fill out this chart of diaper changes and how many times you've nursed. Because when you're nursing, there's this added pressure of, in those first couple of days, wanting to know that the baby is getting enough through how many times they are using the bathroom. And so they make you log it. And I was like, it's very complicated. And she was like, they make you do all that? I was like, yes. And you can easily give up because if you're having to chart every time you nurse and every time the baby goes to the bathroom, but you can't get to the baby because of your incision and it's painful, and you really don't have any independence and autonomy, it can make the whole process frustrating. So, really having that bassinet and seeing how it worked, I mean, it was so exciting. Not that I wanted to have another baby or a C-section, but I just wanted to like the experience of having that. And it doesn't mean also that you have had to have a C-section. Like it's good whether you've, had what I would call a belly birth or not, or a vaginal birth. It's very helpful to have that kind of independence and autonomy. I think it works well for nurses who don't want to be concerned, who may be experiencing burnout, who may be short shifted, and just the relationship between you and the care team is less frustrating because they may get annoyed trying to always respond to you, and you may get annoyed because they're not responding to you. So, just having that autonomy again is really helpful. I was so excited to experience it and see how it works and see how to grab the baby, and such a needed crib or tool in all the hospitals if you're having hospital births. Like, how can we really make hospital births more patient centered, and how can we make it so that the care team can help us and we're working in sync with each other? And I think the bassinet and the couplet care is just a huge piece of that puzzle.
Thank you so much for sharing the reflections. Yeah, I think that the common thread to me is, putting people first and like what do we all need, I mean, to know and to feel and then to have access to be safe and well. And so many things are far from that. And so many things help. And like, um, and after my two vaginal births, like things are uncomfortable, but it doesn't have to be so hard. It's always a lot, even
Mhm.
when things
Mhm.
go as we hope and we prepare for and we're supported. It's a lot. And nothing makes that easy, but so many things can at least not get in the way. And like
Mhm.
so having something designed for you and yet
Mhm.
using human-centered design, I think is just a really helpful to be having all that collective expertise and then following through on that. So yeah, thank you so much for that.
Yeah, and I think it's okay for us to invest to move our care forward and to advance. Like sometimes we just get stuck in like the way things are,
Mhm,
or we've been using this bassinet for many years, and it's
mhm,
just like, yeah, but let's advance how we can support new families, and let's advance how we can support birthing people, and let's advance, like you said, human-centered care
mhm.
and putting the patient at the center. And that's what the bassinet does. And I'm really honored to be a part of the team.
Thank you so much.
Yeah.
And so what are you excited about? I mean, these are extremely difficult times and disproportionately so. And I think having hope, when you said that your colleague, their organization's name includes hope in it, I think that's the most powerful things, because to drive and to have things to look forward to and to know that things can be real. It's not,
Mm.
but what are you currently thinking about in this day about?
Didn't know with the new administration what things would feel like. I mean, initially they felt really, really hard and really uncertain, and no one really knew where to turn, what to do. I'm excited about feeling like things are a little more settled and that I feel like we have come together to support one another. So I feel like in this climate, which has been really rough for maternal health, for health equity, for Black and Brown birthing people, what gives me hope is that I feel like a year in, a year and a half in, we've found our footing. I feel like we have leaned into each other. I feel so much joy and connection and just collaboration, camaraderie between organizations working together to make sure that we support each other, to make sure that we survive, to make sure that we're getting the work out. And so I'm starting to really see those silver linings, those miracles, just funders that are also just coming through to make sure that we are staying afloat. I was really in a dark place when the administration turned over, and just a lot of hopes that I had for being a new ED just became extremely, extremely stressful. Some funders I was talking to went silent, not because they didn't want to support, because they just didn't know which way to turn yet. And so things were kind of just, yeah, just really scary. And I'm feeling like not as anxious, not as worried, and just leaning in now to what we have to do to stay forward, to stay moving forward. And I feel like even with our small nonprofit, we've been able to support and would lean into other organizations. Other organizations have been able to collaborate and support us. And so it's been, for the first time, I'm feeling very supported and I'm feeling very lucky to be able to collaborate. And I feel like it's helping us become stronger and figuring out ways to support and collaborate that help grow organizations and keep us afloat, like working with you on publications and you helping me get the Black Birthing Bill of Rights more visible, and working with other organizations who, may have additional capacity to support some of the work we're doing. And then we've been collaborating on, small summits or small collective events together. So just that's been really hopeful. And I'm seeing us really stay the course no matter what. And just lots of new innovation. And at this point, not being phased because we know the work has to happen. We know that, as we are saying over and over again, no one is coming to save us. So making sure we're in a place to show up for each other and show up for birthing people in this country.
Thank you. That's really, really powerful. And the community that I hear you describing as such a strength, and that I hadn't really thought about how hard times are an opportunity to grow in that way.
Yeah. Definitely, I think we've almost had to grow in that way and not be, I don't think, I don't feel like I was ever in like a super competitive space, but some people would describe, the landscape of maternal health in this country as very niche, very siloed, very competitive. And I think we've had to really lay all those feelings and thoughts down in order to collaborate and work together and move forward. And it's forced us to have to grow in a different way and think differently to stay afloat. Yeah.
Yeah, gosh, I would love to have the field work us out of jobs. You know what I mean? Like that.
Yeah.
There is so much that's needed and so much opportunity and so much, expertise to leverage that I don't think that'll happen in our lifetimes, but that would be amazing if things were optimized, right? If people were cared for and supported, and that we had a robust system, that we didn't need to intervene so much or advocate, because if we had a learning system that was continuously hearing what matters most and making space for that and then acting to constantly improve, that's my dream. And so the competitiveness, that's something I hope can be drastically reduced, because we need each other. It's the opposite, like we're so much.
Mhm. Yeah. And, maternal health is so multifaceted.
Mhm.
I would like to see us break out of our silos even more. So when I say that, I mean like there's one thing to work together with maternal health organizations, but that's not going to get us out of this. How are we working closely with schools and our all the social determinants that we know drive our situation in this country? Like, how are we working together with grocery stores and our food sources and, the food justice and education systems and like all the systems that we know feed into our health and well-being to become mothers and to also parent,
Mhm. Mhm.
So I would like to see how we can connect those worlds more.
Mhm.
Yeah.
And what are measures of success, or how would we know if the system's working well? How do we know if what might we measure to know if we're getting towards thriving? Is I think what we all want is to set people up, right, to have a um, strong life course approach, as you just described, in all aspects. I think maternal health is really about, you know, family health and the health of our societies. And so that a
Absolutely.
hard question, how do we know if we're advancing towards that?
Yeah, how do we know if we're advancing towards that? That's a great question. I think it's so multifaceted in terms of like making sure housing is
Mhm.
improving, employment rates and like long-term security is improving, like incarceration rates are going down. Education is improving across the country. And that's a little tricky one because it's not like I believe in standardized testing and all these other measures of education, but that we have a healthy, thriving youth population, that we're seeing less suicide rates, we're seeing less rates in terms of like drug overdoses. When I think about, I sit on a maternal mortality review committee, and just looking at the gamut of maternal deaths, we are dealing with a lot of maternal mental health issues as well,
Mhm.
a lot of just mental health issues before moms are pregnant. And I won't say a lot, but I will say this is what's coming up
Mhm.
in some of the cases over the years. And so, how are we addressing those? How are we decreasing our homeless population? How are we addressing mental health? How are we addressing places for youth to thrive? How are we addressing places for elders to thrive?
Mhm.
So I think all those will turn the numbers around. And sometimes we think of it in reverse. And I wish funders would like be in this for the long game, but it's always a very specific problem with a very specific outcome. But once we see those things happen, we will see maternal health and infant health improve. We won't see it in the reverse.
Mhm.
So we won't just magically focus on birthing people and babies and see the rates improve. Like, that's not what's going to make it better. And I think I say this all the time, and people are kind of like, huh, okay, but, let's just go back to what we're doing. And I don't know what's going to get us to not just be cogs in the wheel, but to like get the whole thing, the whole machine going, which is that life course perspective. But the data really says that, as you mentioned, that if we are looking at maternal health as a measure of the health of our society and a measure of the symptoms that we see in our society, then how are we working on these issues as a whole and using those as a measure for maternal health instead of, it's important to focus on moms and babies and birthing people and babies, of course. That's huge, but what about the other end? Yeah.
Yeah, enabling conditions and like what's the
Enabling conditions for us to thrive in pregnancy and birth and thrive postpartum and becoming a parent. Like, how are we enabling those conditions for, many funders focus on the areas of 0 to 5 or early childhood health. And so how are we really ensuring that 0 to 5 happens and that those children thrive and
and making sure to take care of the caregivers, meaning the parents or the grandparents, whoever's sort of that core and the healthcare team to be able to support infant, like for their own sake, like first of all, and because infant health is maternal health, like
yes, you're right. Infant health is definitely maternal health. And then just looking at also just how we diminish caregivers overall. So once we start taking the caregiving, us as caregivers and the caregiving industry seriously, paying livable wages for childcare providers, making it free. Because when we're looking at childcare, it's a lose-lose situation. Childcare providers aren't making a ton of money, but it's also too expensive for parents at the same time. So it's like no one's winning. Childcare providers have insurance costs, overhead costs. They can, only take care of a certain amount of babies or children at a time. And then that lends into them having to hire other people. And it's just this kind of game that doesn't work for anyone. And so once we start really investing in our care system, meaning investing in non-paid work, if you are a parent or a caregiver, but then also investing in caregivers, then I think that's a huge part of helping us thrive.
thank you for this. It's so deep because it's really like, how do we value people? Like who do we value? Because then it shows.
Yeah. Yeah. What is the labor that we value in this country? Yeah. And we've seen other countries do it well. And I feel like part of, like, I'm not like, kudos to those countries. You're doing it right. You're doing the right thing. Because honestly, at the bottom of all of this is, systemic racism and classism and all the isms. And so I feel like when I think of countries like maybe Norway and Sweden, they're very homogenous. So they're taking care of their own. What's so crazy about the United States is that the United States will sacrifice. They will have sacrificial lambs to keep a certain level of oppression. And that's what makes it so hard for us to do the right thing and to get out of this, because this country has always functioned on oppression to thrive. And so getting out of that and facing that is a huge part of moving forward.
Exclusionary by design.
Yes, definitely. Yeah. Exclusionary, of course, marginalized by design.
Yeah.
Yes. Which only, of course, benefits a few.
Yeah, intentionally. So much to learn and undo and rebuild.
Yeah, yes.
Well, thank you, Dr. Harris. Thank you so much for sharing your insights and your current work. It's so admirable. So, I'm
Thank
a
you.
big fan for a long time.
So am I. I'm a bigger fan.
I really appreciate you, being in community with me and offering guidance and to, make space to share reflections like these.
Absolutely. Thank you so much.
Great. Thank you.